Well, good afternoon. I'm Captain Malone with Associate Dean College of Pharmacy. I think most of you know me at least. Welcome to the presentation this afternoon. We're lucky we have a presentation by Dr. Jun Sonoda, who is a lecturer at the Kyushu University of Health and Welfare in Japan. Before I mess up my pronunciation. He's going to be talking today about the Japanese National Health System, and he has his PhD, just so you know, in hospital pharmacy and virology. He is a pharmacist in Japan, and I wanted to turn things over to him now. So, thank you.
Thank you very much, Dr. Marom, for your kind introduction. I'm grateful for being able to receive this kind of opportunity. I would like to show my appreciation to Dr. Deborah Parker and Patrick Marom and Hiro Kawamura and Mr. Christopher Schippel and every faculty member of the College of Pharmacy. And I also thank you for holding a small birthday party yesterday. I enjoyed myself very much. Before my presentation, I will briefly introduce my university and our hometown. I'm from Japan, and I'm lecturer with the pharmaceutical sciences in Kyushu University Health and Welfare. It was founded in 1999 by Junsei Educational Foundation based on the mission statement. Our aim is to maximize student individual potential and develop good citizens in both local and international communities. The School of Pharmaceutical Sciences was established in 2003. In first 3 years, our pharmaceutical education was 4 years system. After 2006, Japanese system was transformed into 6-year system. And the first national examination for new system was carried out in 2012. Then produced new age pharmacists, one after another. By the way, do you know where Japan is? How consists of our country? Our country, Japan, consists of 4 islands. From the north, Hokkaido, Honshu, Shikoku, and Kyushu, and other southern islands include Okinawa Prefecture. We have 47 local self-government called prefecture. I came from Nobeoka City, Miyazaki Prefecture, Kyushu, Japan. In our hometown, we have mountains with birth myth of our nation. This is the statue of Amaterasu Omikami. She is seen as the goddess of sun, but also goddess of the universe. The name Amaterasu derived from Amateru, meaning sunshine in heaven, according to mythological stories by the Kojiki and Nihon Shoki. The Empire of Japan are considered to be direct descendants of Amaterasu. Once upon a time, Amaterasu hid in a cave in big wall. The world had been in the darkness. A strong man named Tajikara no Mikoto moved off this big wall. He's a symbol of strong. And this shrine, Amano Iwato Jinja, is worship this big wall. Worship this big wall. We also have river with pure water. We catch the sweet fish. This fish using traditional fishing method named Ayuyana every year from September to November. And we can see sunrise over the Pacific Ocean. Findlay, Ohio is this direction. Over there. There is also nice fishing ground. Well, today I would like to present an outline of Japanese National Health Insurance System for the whole nation and the problem we now facing. This shows plots of GDP per capita and mean lifetime by each country in 2002. You can see approximate correlation between mean lifetime and GDP. This plot shows, indicates the United States of America, and this plot indicates Japan. The two countries have both higher GDP and longer mean lifetime. Next, as another viewpoint of time trend in mean lifetime in Japan. After 1947, both male and female exceed 50 years old for the first time, then sharp increase in the lifetime in this year, and after the steady increase is observed. I have another data which is comparable to Japan and the United States of America. How do you think? What happened in this period? After World War II, social conditions were getting stable. Improved food situation, improved sanitary aspects. Indeed, tuberculosis mortality is decreasing from 1946. My uncle born in 1935 unfortunately contracted tuberculosis when he was junior high school student. In those days, treatment cost for tuberculosis was so expensive in Japan that my grandfather decided to sell off all the livestock animals to save his life. Then I would like you to know that one of the important reasons for improving our mean lifetime is National Health Insurance System for all nations had been established in 1961. This system supported steady increase in lifetime of modern Japan. From this year, all Japans must cover some form of public insurance. All nations in Japan have been able to receive their medical care equally, regardless of amount of their income. It is a schematic diagram of the National Health Insurance System. When patients are insured person or their dependents received medical care at the hospital, they paid the medical expense ranging from 10 to 30% of total expense, mostly 30%. Specifically, as preschool children and elder from 70 to 74 are 20%, and over 75 years old of 10%. And as exception, elder people whose income is the same level as productive population is 30%. Besides, a younger population can receive infant aid from local government. This system the system contents and the amount of subsidy varied by prefecture where they live. In other words, the infant aid system is different in Osaka, Tokyo, Nagoya, Miyazaki. That depends on prefecture they live in. And remaining medical expenditure is paid from independent through payment institution. In order to check the receipt whether medical care are proper or not. This examination system has important role as a keeper of medical standard. Therefore, the examination payment institution should be independent from this medical institution and insured to exhibit its function. Insured raises the fund from to pay 70 to 90 expenditure. The source of revenue are insured person and employment and public expense. I will show percentage of this source of revenue next slide. And insured also contributes to support health care for the elder people. This table shows the revenue source of national health expenditure. The amount of national health expenditure is totally $321 billion. Patient payment is account for 12% of all total amount. Insurance premium from employment and insured person account for 40%, about half of total amount. And public expense from national treasury and local government about 38%. Then I drop the number of percentage. Insured premium from employment and insured person is about 50%. Public expense from national treasury and local government is 38%. And patient payment is 12%. From now, I will now my own medical expense. At the first, I will show my insurance certificate card. I belongs to private school mutual aid association. It's one of the insurance. And my university pay half of my premium, half of my insurance premium. And I pay about $280 monthly to mutual aid association. And this amount for 4 person, include my children, 3 children, as dependents. Then I will show my receipt. When I suffered from stomachache 3 years ago, I received gastrographic examination. The medical service charge is calculated on the basis of nationally standardized point system. 220 points required as first visit fee, and 1,300 points required for examination fee. Totally about 106,000 points. Here, 1 point is equivalent to 10 yen. So totally, total amount I really paid was 30%, 4,770 yen. And approximately this yen is $39. How do you think? It is expensive or cheap? Yeah, it's normal expense. Another example. Before I left Japan, I was diagnosed mild sleep apnea syndrome, and I received overnight polysomnography examination like this. It's not severe, but you laugh, you can laugh. And then examination and hospital fee is about 29,000 yen. And additionally, meal and private room fee, in total 3,300 yen. And this is equivalent to $272. As I mentioned, we could also receive the infant aid. My 3-year-old daughter can see doctor in any hospital, any diseases, as the cost is fixed to 350 yen in each medical practice in Miyazaki Prefecture. 350 yen is equivalent to $3. This system enables us to share the medical expense and to receive our medical care equally. But currently in Japan, this system getting some problem. This shows population pyramid in 2005, and further prediction in 2030 and 2055. You can realize inversing age pyramid like this. This peak we called Dankai no Sedai, or baby boom generation. And he have supported Japan's rapid economic growth from 1950 to 70. The second peak, Dankai Junior, is children of Dankai no Sedai, baby boom, children of baby boom generation. And in 2005, my daughter born in this year, and this hole is same age as mine. There is zodiac sign in Eastern astrology, namely Hino Elma, or year of the fire horse, renowned for disaster and the birth of women destined to kill his husband. But it's just a superstition. And that's why our population is small. I know women as old as myself are a little bit stronger, but they are good wife. Anyway, this hole is a good marker for mine, and in 2030, my daughter will be 25 years old, and I will be over 60 years old. And 2055, my daughter will be 50, and I will be maybe still alive around 90. After the Dankai Junior, the number of births is gradually reduced. Our government predicts that population will be gradually reduced. Besides, the number of productive population which supports the national health insurance system will be reduced, this green area. This trend should be causing excess burden on younger population in future. My daughter will be also need to support elder population, including me. Indeed, the ratio of above 75 years old people of Japan's overall population is gradually increased. The national health expenditure for this 10% of elder population consists 1/3 in 2007. It's the main cause of increasing in medical expenditure. This figure shows the national change in annual change in national health expenditure, NHE, disbursed, and the ratio of NHE to national income, and the ratio of NHE to GDP. The national health expenditure goes on increase year and year. The latest amount is about $321 billion. The annual expenditure per person is about $2,480. This cost, according to more than 10% of national income. About 35% of expenditure is spent for elder population over 75 years old. In order to reduce excess burden on productive population, the improved healthcare system for elder population had been enforced. In briefly, elder people bear 10% of their own cost. This slide summarizes the general idea. The size of frame indicates the population size and the amount of fund. About 10 to 90 for population size. 35 and 65 for the amount of fund. Independent fund in insure for elder population over 75 years old was newly established. The source of revenue of this fund are 10% of insured person and 40% of consist from insured from productive population, and 50% of this public expense. One more thing. The strategy with highest possibility for reducing the national health expenditure is cut down the medicine expenditure. Percentage of medicine expenditure within the national health expense is more than 25%. The market share of generic drug is 40% in Japan in 2010. That of USA is more than 90%. You can see various percent in other countries. Our government Ministry of Health, Labor and Welfare decided to achieve the target value as 80% by 2070s. Well, it is all for the contents which I want to present today. Lastly, I will show our government statement. Japan has been attained the longest of mean lifetime and the highest level of health care in the world. In order to secure citizens safe and life, we need to strictly remain the national health expenditure for the whole nation based on social health system. Okay, thank you for attention.